Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm your host, Jennifer Dusablon. Through this monthly show, we bring you information about Franklin County Home Health Agency's programs and services, as well as helpful tips to help you and your loved ones stay safe and healthy at home. Franklin County Home Health Agency is our local nonprofit home health care and hospice organization that has been bringing services to people of all ages throughout the 15 cities and towns of Franklin County since 1969. So thank you for joining us today. Franklin County Home Health Agency has a lot of new things happening this spring, and we wanted to share those with you. And we are also celebrating Medical Social Work Month this March. So I've invited two guests with me today from Franklin County Home Health. Thank you for being here, ladies.
Good morning.
With me is Traci Osterhoudt. She is a medical social worker, so we are celebrating you and your team this month. And Nancy Dulude is our hospice volunteer coordinator. So thank you, and I appreciate both of you for coming out. I know you have busy schedules today, and thank you for making the time to share what's going on at home health. So Traci, we'll start with you since we've put social workers on the hot spot this morning. As a medical social worker at Franklin County Home Health, I want to hear more about what that is, but tell us a little bit about yourself and how long you've been with the agency.
Okay, so I've been with the agency for about 13 years. I started off working strictly in our maternal child health program and then moved on to working with that program, but in addition to working with seniors and elders. So I do a little bit of everything.
Yeah, great. Now, did you work somewhere else in this field before you came to home health?
I actually, prior to coming to home health, I've worked as a social worker. I have worked in a couple of different settings, but it was more with children and families. Okay. So it was a nice change for me, and something that I really enjoy, working with seniors and working with elders. So it was an important move for me.
Yeah, wonderful.
Yeah.
So I remember, so you've been there 13 years, which is incredible. That's wonderful.
Yeah.
And I was going to say that about 20 years ago when I was there was one, maybe one or two. So when you came on, I think, excuse me, you had a small team as well. And
we did. There was three, when I came on full-time, there was three other social workers that were part-time folks. At this point, through our agency, we now have 5 full-time social workers, so it has grown pretty dramatically over the years.
Now, do you work with pediatric and senior? Do you split that up, or do you all do a little bit of both now?
Primarily, I'm the one that works with pediatrics when there's situations or cases that come up. My coworkers are all more of the home care, working with seniors, elders, young folks with disabilities, that sort of thing.
Yeah. So what is a medical social worker, and how is that different than the term social worker?
So medical social worker, our role is to help folks cope with stress of illness. We help make sure that folks are able to obtain community services and resources that they might need to, for instance, help keep them in their homes. That's obviously our goal through home health, is to help folks remain in their homes for as long as they can and they wish to. So we really work hard to try to get resources in place and services in place that will help support them to do that.
Of course.
But our focus is more on helping folks deal with stress from illness and coping with that.
And that's the medical side there.
Yep.
Sure. So in home health care, we talk a lot about serving the whole family. Can you talk about family dynamics and how you help there?
Sure. So whenever we go in to meet with anybody, work with anybody, nobody stands alone. Everybody has got somebody that they're connected with. So the reality is, when we look at providing services, we're looking at how do we support everybody in the situation, knowing that caregivers, for instance, need to have as much support as the individuals do to continue to be able to provide that support for them. So our role is really, obviously we have an identified client through the agency, but we definitely want to make sure that the caregivers are getting what they need as well to be able to continue to provide in the home.
So as you mentioned, having clients, how does it work in home health care? Do you see clients exclusively as a medical social worker, or is there a nurse supervising? What is the situation usually like?
Well, we, through home health, have a few different programs that we work within. So we do work as case managers through a program with the state called the Choices for Care program. Within that program, there's not necessarily other providers from our agency involved. When we do more of a home care program, which is when there are nurses, physical therapists, occupational therapists, speech language, any number of disciplines that could be involved, we do have our other staff members that we are working closely with as a team.
Sure.
Yeah.
And I imagine you are important too in making referrals within the agency in addition to the community resources.
Yeah, absolutely.
So name some of those community resources that you help people connect with.
Oh my goodness, we work with folks and getting them connected with state benefits a lot. Community Action is one that we often will refer to. Champlain Valley Agency on Aging is another one that I feel like we work fairly closely with. There's a lot of more of the individual community kind of focused resources that, depending on what territory we're working in, folks will access. For instance, the Lions Clubs are able to support folks in some ways. We work with some of the organizations like the American Legion and those places that do loan closets for equipment, so that folks can access equipment that they might need when insurance won't pay for it. So it's a very wide variety of folks that we work with.
Yeah. So you have a lot of things to keep track of. What do you do for staff development? What kind of activities are you involved with to stay up to date with all these resources?
We try to attend as many trainings as we can so that we can keep an eye on how things are going and what's changing, because the reality is things change every day. And so we try to make sure we are attending any of the trainings that are available to keep us updated. Within our group, we're trying to also do some of our own staff development and looking at areas that we all need reminders of, boundaries, those sorts of things, to really make sure that we are doing the best jobs we can.
Excellent, good.
Yeah.
So medical social workers do a lot for a lot of people. You work, as you said, in home care and in hospice.
Yes.
And I'm sure, so Nancy, you can help explain hospice with us, and then we can talk about how social workers help out in hospice. So give us a quick overview of the hospice program at Home Health.
So our hospice program is for anyone with a prognosis of 6 months or less to live. The doctor will give a referral, and as long as they meet the criteria, extensive clinical criteria for hospice, they would be eligible for that. So it's a choice for end-of-life care. And it is multidisciplinary. Social work is a very important component in that we have spiritual advisor, we've got nurses, LNAs, care attendants, volunteers, the different therapies, medical directors, certainly part of that, or a hospice manager. And the unit of care being the family as well as the client. Again, we're all working as a team to provide the most comprehensive care possible.
Yes, and so what kind of things are you helping people with in hospice care at the end of life? What comes up for social workers? What can you do for folks and families?
Yeah, a lot of what we do I feel like a lot of what we do is really supporting families. Again, obviously the client is the identified patient through home health, but again, we want folks to be able to remain in their home if that is what their wish is. So making sure that we are trying to support the whole family to keep them there. It's in addition to providing support and assistance prior to the death of a loved one, we also will follow folks for a year after and providing some bereavement services and checking in with families and making sure that they're doing okay and helping them to connect to some more even long-term supports if that's what they're going to be needing. So.
And I just want to say too that family is a pretty broad-based word too, and we have blended families, different families. Family doesn't even have to be blood. It can be your best friend is taking care of you, or
I think family is often defined by the patient themselves.
There you go. Yeah, and maybe who they're living with or the situation they're in. Sure, good point.
And it's wonderful, and I'm noticing that a lot more folks are taking advantage of the social work component and the entire hospice package, not only just while they are sick, but families are being very receptive to us following up with them, whether, like you said, it's phone calls, visits, cards. We really do care, and we want people to feel supported.
Sure, because that bereavement is important that you said that extends a year out, because like grief doesn't have a timeline, so we know that we want to still be there and help people as they experience that first year and set them up for years to come.
Right,
Sure.
and we even have our grief support group too, which is the first and third Wednesday of the month, and it's at the agency. It's at 7 o'clock. It lasts about an hour.
And that's for anybody in the
Anybody
community,
in
whether
the
or not you've been
community,
served.
you can come one time, you could come 10 times. There's no commitment that you have to make. There's no cost, no commitment, and it's very informal.
Good, thank you for mentioning that. So talking about preparing for end-of-life care and helping families and patients through that, we should talk about the program that we have, the Start the Conversation program. So I'm wearing my button. I started the conversation. So what is the conversation we're talking about there? What is Start the Conversation?
So it's a statewide VNA, the Visiting Nurses Association of Vermont, in collaboration with the Vermont Ethics Network, has come up with a wonderful packet of information on how to have difficult conversations with your family and loved ones on what your wishes for end-of-life care would be. And it talks about palliative care, hospice care, directs you to different resources, and it's very user-friendly.
You have a copy of a packet there with you, Traci?
Actually.
Yeah.
I do have one of the booklets.
Very nice, yeah.
And it comes with many different things in here to help folks start to think about how to have these conversations and how to prepare for them.
Right. So we're, as a culture, it's not easy for us to talk about death, and not even just death, but we're talking about medical choices here as well. So talk about what Advance Directives. Can you talk a little bit about Advance Directives? That's what we're talking about here, is planning some of that advanced planning.
So Advance Directives, we strongly encourage anybody over the age of 18 to have Advance Directives done. None of us know what tomorrow holds, and throughout our lives we prepare and plan for a lot of things. This is not always one of the things that we're very good at planning for. So we encourage everybody to have them in place, and those Advance Directives do a few things. First of all, they identify who you're wanting to make decisions for you if you're unable to make them. So it does not take away your ability to make decisions. It only has somebody identified to step in if for some reason you're not able.
Okay.
It's very empowering, actually. People think they're losing control, but it's very empowering to make that decision and know, only if you can't speak for yourself, that somebody that knows your values and your wishes is going to make sure that those are carried out.
So it's someone you've had these conversations with.
Absolutely,
right?
and that's where the
So
starting
what
the
do you tell them? So
conversation-
this helps, what would I talk with that person about?
Well, so through the Advance Directives, you identify your folks to who would be making the decisions for you, or not even making decisions necessarily, but being your voice if you're not able. So it would be around issues, some of the tougher issues that folks sometimes have a hard time thinking about, as far as specific medical treatment that they may or may not want. It talks a little bit about hospice care and where folks at the end of their life, where they would wish to be and how they wish to be treated. Talks about end-of-life planning and decisions around funeral arrangements and those sorts of things, which again can be really tough decisions and tough things to talk about, whether you're in a place where you're very healthy or not. It's not always something that folks like to think about, but can bring great relief to people, both the individuals and their families, if this is in place in advance.
So the family knows that this was the person's wishes, and they can settle those emotions they may have around it.
Exactly.
You mentioned 18 and older. Like you said, this isn't something we can put off, but are people afraid to do it early? Talk about how easy it is to change it. Is it okay to change, and how often?
Absolutely.
You should update it periodically as healthcare changes. It seems like with every decade that we're alive, our views on things can certainly change, can and do change, and to be looking at that when you've had something significant happen. Also, too, people used to keep all this a secret. They would choose who they wanted to have speak for them if they couldn't, and then they wouldn't even tell that person. So the conversation about telling someone, this is what I'm thinking, would you be okay with that? And making sure that person is on board and does share your same values.
And can ask questions. And
yes,
have
absolutely. And I know last year in April, so we really had a big movement to do this. And people would always say, oh, well, it's too overwhelming. There's too many choices. I can't decide what I want to do. If at the very least, choose who will be your spokesperson. If that's all that you know now, that you feel very strongly about, you can add to it at a later date, but don't put that off.
And
at
thank
any
you for,
age.
we did kick this off last year in our community in April, and we're doing that again. So there are community partners, and it's Home Health, Department of Health, Northwest Counseling, St. Albans Health and Rehab, the Franklin County Rehab Center, Northwestern Medical Center, and Notch. All of those agencies are internally saying, hey, let's have a challenge and see if our staff have made these advanced directives, know about this. So we're doing that again, and then kicking off sort of the community-wide efforts. And you can talk about how we have a speakers bureau, basically. I don't know if the two of you do some of that. I know, Nancy, you've done some training. How do people access if they want, say, another organization wants to have a challenge in their office, or they want to teach their employees
They can give our agency a call, and we can guide them on what we've done, what they could possibly do. We are more than willing to go out into the community and give education. I've talked with various groups, I'm sure Traci has, on Start the Conversation. Can be anywhere from a half an hour to an hour, hour and a half, depending on if people have a lot of questions. And it's people are afraid, so we're taking a fear away. It's nothing to be afraid of.
Very well. I love that. I just like how it's start the conversation. That's exactly what we want to encourage.
Have a cup of tea or a cup
glad
of
we're
coffee.
talking
I
about
think we
it.
drink coffee more here in Franklin County than we do tea.
Sure, whatever works. So that's one thing happening in April. Another thing that's coming up this spring in May is the Childhood Bereavement Seminar. Can you talk about what that seminar is and where that came about and how it relates to the Childhood Bereavement Program? So, Nancy.
So Thursday, May 12th, we're going to have a community seminar for area providers on bereavement support for our young folks, children through teenagers. I know when we had deaths in my family, when my children were 5 and 9, Grandma died, and there was no resources here in the community. And then 8 years later, Grandpa died, and guess what? We still have no resources in the community. So it developed for, the need is there in Franklin County, and we do so much in Franklin County to support everybody that we don't want to send our families to Chittenden County when we could do something here. We have a wonderful partnership with the United Way, and they are helping us to achieve this goal. So our goal is to be able to provide bereavement support in the form of resources, projects, take-home things, and education.
You brought some beautiful things. I'll just cut you off for a second to talk about the things that you brought here. What are these tools?
So this is called a Darn It doll. You may have heard of a different, older version of this, but these are cuddly and a safe way to express your grief as a child or as an adult. I mean, we could all probably have one of these on our table. So our volunteers get together with me, and we make these types of things. And we make, these are called yelling boxes. So we make these and give them to families, or we can even just give them the directions on how to do it, because it's a great project where it's full of stuffing, and you can yell into here, and it muffles your yell when you're frustrated. So safe ways to expend your energy. We've also developed some memory boxes. So this would be one for a teenager, and they would be able to put a picture of their loved one who has died, and then inside the box would be various things, books and journals, and we've got origami, how to do that, clay, colored pencils. The younger version will come with a little puppet. So these puppets are washable. So we give them washable markers, and you can draw on it how you're feeling today. And then when you feel differently tomorrow, mom or dad can throw it in the wash, and you can start all over again. So for families that we've had requests, we're going to provide them with a memory box, and they can keep these things inside and add to them, and it's a great way for them to talk and keep that person's memory alive.
So right now, that's so basically it's a new initiative through Franklin County Home Health for patients who have been served by us who have young people in their family that are experiencing
pediatric, palliative, or hospice patients, but we're hoping to even expand that into the community if we had a call for that.
Sure. And so that ties into the actual seminar that we're having, as you said, May 12th, geared toward professionals who are working with children, but anybody in the community interested in hearing some of these resources. Can you talk about what people can expect at the seminar?
Sure. So the thing that I think folks often don't recognize is that grief with children and grief with adults looks very different, and oftentimes the tools that are useful are very different. So the seminar is actually going to focus on distinguishing the difference between the two, grief with adults and grief with children, describing the effects of grief on children through various stages and developmental stages, I guess you could say ages and stages. It's going to work on trying to identify strategies to help folks help the children that they know to deal with grief and loss. And grief and loss can mean so many things. You know, it's loss of more than just people, the important people in their lives. Children can grieve as we do as adults as well. So it really is potentially going to be a seminar that everybody could benefit from and take something from.
Wonderful. So, and if folks want to hear more about that, we'll have all of these. We do have links on our Facebook and on our website that talk about this seminar. Another really cool program that ties into grief and bereavement is the Bookends program. So that's coming up when?
Yes, that'll be Thursday, March 31st at the St. Albans Free Library. It's free, open to the public. We encourage you to give us a call and reserve your spot because the seating is limited. So we'll be talking about 7 different books. When Breath Becomes Air, Being Mortal, on Grief and Grieving. There's 4 more that we've got. And you don't have to have read the books. If you're curious, you've heard about the books and you want to know what they're about, how they could help you. So it's meant to be an informal discussion between people who have read the books or people looking for very good, pertinent resources. So there'll be some volunteers, some other staff, and we encourage anybody in the community to come.
Wonderful. So that's a lot of things happening. And lastly, in March is the job fair that's coming up at the expo there. And we will be there. So before we close, I just want to ask you, what would you tell folks who are interested, who may be considering a career in home health care? What would you tell folks, Nancy?
Let me see. I've been there for 11 years. It's important to work in the community that I live in. Franklin County is a wonderful community. The agency has been there for so many years, so we're here to stay. And it's always a group of people that are just highly ethical and very caring individuals.
Nice. How about you?
I think back through the years of different jobs that I've done and my time at home health, and I just always come back to what a privilege it is to be able to work for home health. I am amazed every day at the folks that I work with, both my staff, fellow coworkers, and the individuals that I'm going to see. I recognize how hard it is for folks to kind of allow us into their safe space, into their homes, and they do that. And it's a privilege that we're able to go into people's homes in that way and help support them and try to work with them from where they're at and bringing in what they feel like they need to remain safe. So it's different every day.
Yeah,
and it's very unique.
Yeah.
Every person is unique.
Absolutely.
Everyone has a story. And I don't think there's any job here in the county that is like it. It's a wonderful place to work.
Good. And we are so glad to have folks like you on board on the team. So thank you for everything you do in our community, and thank you for sharing today some of that. And thank you for watching. And if you have any questions about the programs we talked about today, you can call our agency at 527-7531. And of course, you can check us out online at www.fchha.org. Again, thank you for watching, and be well.